Welcome to H&HN Daily. I'm Susanna Hopsolin, Senior Editor for Hospitals and Health Networks magazine. In the hospital setting, communication among the patient, family members, and clinical team is key to good outcomes and patient and staff satisfaction. Citizens Memorial Hospital in Bolivar, Missouri, developed an electronic whiteboard for the patient room to keep everyone up to date. Today, I'm joined by Jonathan Moores, Network Administrator, and Lauren Frazier, Webmaster, Citizens Memorial Hospital in Bolivar, Missouri, to discuss using electronic whiteboards to improve the patient and caregiver experience during the hospital stay. Welcome, Jonathan and Lauren. Thanks for joining us today.
Thank you for having us.
Yeah, we're excited to be here.
You have this electronic whiteboard in the patient's room. What does it do? What are the features? And how does the patient, their family, and the care team use this electronic whiteboard?
Yes, so the electronic whiteboard is a great tool to engage the family, the patient, the caregivers into one package. It allows us to real-time transmit data to the patient's room that is unique to them, that will help them know where they are in their process, in the caregiving process. We do have on there their estimated date of discharge, so that is very helpful to the patient and their family to be able to know, hey, when am I actually going to be discharged? Beyond that, we're able to show nurse rounding info, so that is a way to show when care has been provided to them and is a way for them to check up to know if that care is being provided in a timely way.
Is there anything on this that shows what kind of risks the patient might have and what you're on the lookout for?
So we post the fall risk, and we also post diet information as well as activity and weight-bearing status. So that kind of lets the patient and their families know what they can expect. So can I help this person get up and use the restroom, or do we need to call a nurse because they're a high fall risk?
Very often when you go into a traditional room, you're on the whiteboard, they may or may not have updated who's even on the care team. How does that work?
On the board, we have a section that is specifically to the care team. So that is going to show them their names and the number to get a hold of them directly. Also below there, it has a few other helpful numbers on there. So it's going to show them if they have family that wants to call, it shows them the room number that's on there. We've got a number on there for the diet aid. So just great resources for the patient.
Does this also help the care team in terms of their coordination of care?
It sort of allows them a quick reference. I mean, of course, they have the whole chart with them on the computer, but it allows them a quick reference when they walk in the room. You know, a provider can walk in and look and say, your pain goal's a 4 and you're at a 6. What's going on? What can we do to make that better? So, and it's also a good way for the patients and families to start a conversation with the providers and nursing staff.
This is a low-cost, high-impact solution. How did you get the project together, the funding, the support you needed?
We actually got the funding threefold. I'm actually a part of a HRSA HIT grant, and that funded part of it. We were actually about to spend, to me seems crazy, $10,000 on just standard marker boards for the rooms. And we kind of got involved and said, hey, we've got this solution. Can we use those funds and apply them to this? And then we were able to throw a little capital money at it also. And like you said, it was a way for us to do it all internally for low cost, high impact.
How have clinicians responded to this project?
It's been a positive response all around. Like I said, it kind of walks in and gives them a high-level overview of some of the most important care aspects to patients across the board. And it also has some accountability in it. So, you know, if the nurse hasn't been through, you can see that on the board. And I think that helps as well.
And are there other members of maybe ancillary care team members that are interested in participating in this?
Most definitely. We get requests all the time for content that they would like to be added. Of course, we have only a certain amount of real estate, but I mean, we deal heavily with rehab, respiratory,
social services.
Social services was the other one, and those are the three main ones that we're actually working on currently to add content specifically for them.
And what about a physician component? Are you looking at that too?
Yes, we're looking at adding information on physician rounding if possible. It's a little bit trickier because physicians don't always know when they're going to round. But even something as simple as knowing who the attending physician is makes a big impact on the family. They know who to ask the nurse to ask for and who to expect to be showing up that day.
This solution really seems to foster a lot of transparency in what's going on in the actual healthcare setting on the inpatient side. And how has this affected patient satisfaction?
That was our goal, was transparency across the board, to not have it be your care being something that's hidden and you never know what is happening. This is a way to fully engage them and let them know, hey, I'm about to be discharged in a couple days. I can call my family and let them know this. And we have seen a positive incline in our patient satisfaction scores. We can't attribute them directly to the whiteboards, but it's just timely that we implemented them and we're seeing this incline.
Thanks for joining me today.
Thank you for having us.
Thank you.